Welcome, everyone, to today's virtual roundtable, Community Hospital Resilience, Lessons Learned from an EHR Implementation Amid the Pandemic. I'm Brian Zimmerman, your moderator for today's session. On behalf of Becker's Healthcare, thank you for joining us. So before we meet our panelists, I'm just going to go over some quick housekeeping items. So we'll begin today's session with a panel discussion, and we'll have time at the end for an audience question and answer session. You can submit any questions you have throughout the program by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link used to log into today's program to access the recording. There are a few different engagement tools you can utilize during today's event. Additional resources are available for download in the resources widget on the right-hand side of your screen. We will also have a poll question that will pop up in your slides view. You can answer the question directly on your screen. Lastly, there's a brief survey also on the right-hand side of your screen. We thank you in advance for your participation there. So finally, if at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. So now I'd like to go ahead and take this time to briefly introduce our esteemed panel. We are thrilled to be joined by Bonnie McGuire, Senior Solutions Manager at Allscripts, Heather O'Brien, Business Operations Leader, Client Delivery Services at Allscripts, and Dr. Karan Singh, Chief Quality Officer and Medical Director, Department of Emergency Medicine at San Gorgonio Memorial Hospital. Thank you, Bonnie, Heather, and Dr. Singh for joining us today. And before we jump into our discussion, we're going to go ahead and kick things off with a poll question here. So we want to learn more about our attendees here. So as a reminder, you can submit your answer that best fits your organization right here on your screen. We're looking forward to your participation. So I know you all can read, so I'll give you a few moments to just select whatever answer works best for you. Just a few more moments. All right, looks like a lot of you are dealing with some financial resources strain there, and I think we'll definitely get to that in our conversation. Looks like limited resources as well, and of course clinician burnout and community outreach. I think everyone is experiencing some of that in some fashion. So I appreciate you all being here, and let's just dive into the discussion. So question one here: what are the challenges facing community hospitals as we advance here in 2021? Bonnie, I'm going to throw this question to you first.
Okay, thanks, Brian. So there are over 4,000 active hospitals in the U.S. that have less than 300 beds. So obviously community hospitals are a very important provider of healthcare in this country. And it's important when working with those hospitals to understand what makes them different from large integrated delivery networks and where they're the same. As everybody knows, most community hospitals provide a large percentage of the same testing and services provided by the large hospitals, and they need to be able to do that and do it well. However, community hospitals often have less employees available to provide those services, and that leads to people wearing more than one hat and those individuals having a wider breadth of responsibility. And it also isn't uncommon for departments that are open 24/7 at larger hospitals to not be at a community hospital, such as pharmacy and some other ancillary departments. So those factors need to be considered when designing and implementing an EHR for community hospitals as we move forward. So looking to the future, it's very important that the EHR that's being put in and being used has been built and configured to cover the functionality needed for those hospitals to ensure they're meeting the needs of their patients with the resources that are available to them. And so they need to provide that care across the different venues, and the EHR needs to support them in that while simultaneously providing them a way to move forward as technology advances. And that is a very important thing that we need to make sure is incorporated as the community hospitals move into the future. And I think Dr. Singh has a different perspective on it and some stuff to add.
Thanks, Bonnie. Yeah, I agree. I think for My perspective is survival. That's speaking as a physician, but also kind of the hospital administration standpoint as well. I think the biggest thing is kind of motivation. This kind of pandemic affecting the hospital and the clinicians. What we thought was going to be a sprint ended up being more of a marathon. So from my perspective, it's kind of dealing with the effects of COVID and then kind of the lasting effects of it as we move into 2021. There's just different questions. When we first started, it was, what is this virus? How is it going to impact the health of our community? And then it transitioned to, what are the treatments? Are there good treatments? And now we're into the realm of these new variances. Will the vaccine be effective? And then there's also all the other things that as a hospital, we put on hold because of COVID. So things like quality improvement projects, patient safety projects, we kind of have to refocus on those efforts as well. So it kind of added an extra lens of complexity, as you might imagine. So patients that were admitted to the hospital, their families weren't allowed to visit them. And there's this patient experience component that's completely now putting them in isolation. So trying to figure out creative solutions around that. We had iPads and, having FaceTime with the family members when the patients were admitted. That was a good solution at the time. But definitely, I think challenges for 2021 are going to be a lot different than what we dealt with in 2020.
Heather, did you want to weigh in here as well?
Yeah, thank you. Thanks, Brian, and thanks to the Becker's Group for having us here today. I want to echo what both Dr. Singh and Bonnie said, and kind of add to that. I would venture to say that one of the biggest challenges for community hospitals and EHR vendors alike really is the unknown. 2020 was an unprecedented year that posed a lot of challenges, both personally and professionally, I think, for everybody. And 2021 to date has also experienced, an uptick in COVID cases in many areas. And that's really forced us all to be very flexible. Our clients' needs now are more urgent than ever. They're quickly adapting to evolving patient care needs. And in many cases, setting up tents and parking lots for extra beds. At the end of 2020, we partnered with a lot of our clients, including San Gorgonio, Dr. Singh and other leaders there at the site, to create new units to accommodate those patient beds, which didn't previously exist. I anticipate that the resource constraints and availability to work on projects, like Dr. Singh said, will continue to be an issue for the first part of this year. And really a strong partnership is more important now than it ever was.
Yeah, absolutely. I think all those comments there sort of set the stage about what all our attendees are likely dealing with in some fashion. That brings me to my next question, though, which is, it's been such a challenging and transformative year. So what's really been the shift here in healthcare? Bonnie, I'm going to turn to you to start this one off.
Well, one thing the pandemic has definitely shifted is the utilization of telehealth. It is now being used to a much higher degree than it ever was before. Prior to the pandemic, a lot of customers were looking at telehealth, and it was being looked at as a component that might be able to be used in some areas where access was a problem. And customers were starting to venture into that area, but it wasn't a big priority for them or a high use item. And in the early stages of the pandemic, that shifted what felt like overnight. And suddenly the physician offices and clinics needed a way to be able to provide care to their patients without putting their staff at risk and without increasing exposure for the patients. And so suddenly telehealth became very, very important. And people got it implemented very quickly and started using it. And that has now exploded. And people that had resisted using it or not even considered it were suddenly very avid users of it. And this led to the telehealth no longer feeling like an option. It has really moved forward and become very embedded in a lot of the ambulatory offices. And a lot of patients have very quickly begun to expect it to be part of what's an option that's out there. My daughter recently had very minor surgery, and when they told her she was going to have to come back from school for her follow-up appointment, she just looked at them and said, seriously, you can't do it virtually. Whereas prior to this pandemic, she would have never even thought that virtual healthcare was an option that was out there. And now it quickly became an expectation from her perspective. So that the pandemic really shifted the utilization of that component very quickly.
Dr. Singh, can you build on those comments there? I think I'm struck also by like sort of the change in patient expectations for sure. Anything you want to add to what Bonnie had to say there?
Yeah, no, I completely agree. I think it's there's a lot of barriers to access. Telehealth was a natural solution to kind of address that. And I think that patients kind of were a little bit more empowered also to kind of have more of a comfortable environment to talk to their doctor in their house, as opposed to going to a clinic or so on and so forth. So I think it did shift, and it's going to kind of shift even more towards that area as well. The other big shift that I saw was kind of the practice of medicine, and then kind of taking care of the clinicians. I don't think me as a physician ever figured, I would be prone to getting an infectious disease so readily available that's, so spread across so fast in our emergency department, in our hospitals, and kind of hospital across the United States. So it definitely put a lens of humility for our clinical team. And I think that shift has kind of expanded towards us kind of following more infectious control guidelines, implementing safety protocols for our patients could be protected, but also so that our clinical staff could be protected as well. And I think telehealth, what Bonnie presented for the clinic setting for outpatients, that's also useful. For the inpatient side, we also use telehealth to round on patients so that we didn't use or burn through PPE as much and or expose staff unnecessarily. So we could kind of reevaluate the patients with that little robot that would go in the patient's room. So it's changed the landscape significantly.
Appreciate you sharing those insights, Dr. Singh. Definitely, I think your perspective is so important. Heather, you want to tackle this question as well. What shift have you seen in healthcare over the last year?
Yeah, first I have to say I can definitely relate to the story that Bonnie told. I mean, I personally have seen my doctor through telehealth visits a couple of times over this last year, and it was my first experience from a patient perspective, and I loved it. I mean, I can't imagine going back to, the traditional in-office visits, except for things that, specifically require that. So for me personally, from a patient perspective, that's, been one of the positive things to come out of this. But, I want to address the question from a slightly different perspective, more from the Allscripts side and just kind of from a project perspective. Over the past couple of years, I think we've noticed a shift from the need for customization to the desire for standardization. I don't think it's a secret that standardization has a lot of benefits to it. Specifically from an EMR perspective, the ability to flex staff across multiple facilities without a ton of additional training, decrease maintenance costs, the ability to capture meaningful trendable data over time, and enhance quality reporting are just, some of the benefits that we see. But I would also say that there's been a big kind of pendulum shift from those client designed content to not just a desire for, but almost an expectation of evidence-based content. It's something that we, from an Allscripts perspective, have traditionally offered as an add-on or optional package, but this shift in the market has really led us to reevaluate some of the packages that we offer, and we're now starting to incorporate that evidence-based content and licenses from our partners at Elsevier and AORN to really kind of accommodate that shift that we're seeing in the market. So I think that's a big thing from my perspective is, the desire for standardization.
Thank you so much, Heather. And yeah, that's sort of, I want to zero in on the EHR piece of this with the next question here. Dr. Singh, I want to ask you, so, what were the top challenges you needed to solve for when you were choosing your new EHR?
Yeah, a lot of challenges for our team, but I'm kind of impressed that Bonnie and Heather are able to see their doctors. I don't even think the last time I saw a physician, my team always kind of jokes that I see a doctor in the mirror every single day, but we're always very stubborn. So I think it's really enlightening to hear their story because we're traditionally not good at taking care of ourselves. So in regard to the top challenges, there were, for us, specifically for our hospital, understand the quality of care that was being delivered to our patients and kind of looking at what the care that frontline staff was delivering and also kind of understanding the challenges and the struggles and how could we best empower them and kind of give them the tools that they need. So the first part was to kind of look at the analytics of, our door-to-doc time for the emergency department or length of stay for in-house hospitalizations or readmissions. So just kind of understanding where we are today was the biggest kind of metric that we wanted to understand. In addition to that, it was kind of streamlining our organization in one platform. So the patient walks in to the emergency department, kind of the communication that happens starting from the triage nurse to all the way to the case management staff, to the ED physician, to the hospitalist, to the intensivist. Everybody's on the same platform. They kind of understand the natural progression of the patient as they've been in the hospital, what changed, what didn't change, so we can all kind of communicate. And I think that's the biggest challenge in medicine is people communicating. And I take ownership as a physician. I'm not that good at communicating with our specialties just because our system's designed to keep us so busy. So I think it was something a tool that we could utilize that would allow us to communicate better amongst our team, but also kind of look at it from a patient's perspective of what care they're getting delivered.
Some really, really, really important considerations there. I think the pandemic has certainly highlighted the importance of communication in healthcare. So I think that will definitely resonate with folks. That brings me to the next question then, which is, what were some of the nuances with implementing during a pandemic? It's a challenging time already. So I think, Bonnie, if you can kick things off here by diving into this question. Bonnie, you might be on mute there.
Although our standard implementation model for implementing our community solution does have take into consideration the importance of expenses and limited on-site resources in order to be conscious of that, it forced us to look at that and evaluate it and see how we could limit it further and what we could leverage on the technology side so that we were able to still successfully complete activities that we would have previously done on site. And we were able to do that, including up to our actual activation. We limited the number of people that we put on site for an activation, which anybody that has been involved in an activation knows that usually it's a cast of thousands. And we limited that number down to really less than a couple handfuls of people. And we were able to put on the big screen all of our other resources. So they were able to be live on the screen and interacting with the people in the command center during the activation. And it worked very well. So that was one way that we were able to change our implementation strategy, but still be successful.
Thank you, Bonnie. And then Heather, from your perspective, can you answer this question? And what were some of those nuances?
Yeah, this is a great question, and I remember very vividly having our project manager on the big screen in the command center, and trying to navigate through all of that. But we make it work, and we did, and we learned a lot throughout the journey. But implementing during a pandemic was definitely challenging, specifically because resources were limited across the project team, both on the client side and our side. In many cases, I think that this caused kind of a lack of engagement from key resources, not because they didn't want to participate, but they're tending to patients, and some of our testing timelines ended up having to be drawn out over a longer period of time. I mean, Dr. Singh, you'll probably remember at San Gorgonio specifically, we had to change our education strategy at the very last minute because the California rules about gathering would only allow for a handful of people in the same room at a time, something I don't think we ever thought we would have to address. So those timelines were extended even further as well.
Dr. Singh, you want to build on those comments?
Yeah, no, I definitely remember those times. It's, you know, it's like going uphill and strapping on 100 pounds of just weight and then trying to figure out how you'll survive during the pandemic and implementing the system. I think the biggest challenge was trying to pull the clinicians away from bedside care. And, you know, they have critical patients in the middle of a surge. And so it was a very challenging time to kind of figure out how do I motivate clinical staff, because I need their input for this program to be, being implemented to be a success. But they were obviously really, really busy. So I think we transitioned to more of a kind of a virtual platform for education instead of having in-house kind of classes for our staff. So I think that was beneficial towards the end. And kind of having enough time to get everybody's input also was key, in having kind of like a high level of engagement between the leaders of each department who would be the voice on the floor to kind of say, okay, this is something that our organization definitely needs. It's painful and there's growing pains with any kind of new project or new implementation. And there's going to be the 50 people that come and whine and will just whine and whine and whine. And there'll be the 50 people who say, okay, fine. And then the other 50 will just say, oh, this is great. So you kind of have to balance that out and find a way to kind of motivate the ones that are straggling along to say this will actually save you time later on if you kind of invest time up front with it. So those are the challenges, but I think we kind of figured out a solution towards like the middle end of implementing the education part.
Thank you, Dr. Singh. And before we move to the next question for the group, I just have a follow-up for you. You know, how are you better equipped now on this new EHR for, you know, possible resurgences, vaccine distribution, and you know, any possible other future health disasters that could befall us? You know, what's different?
I can go first. I mean, I think I sent a message to the Allscripts team, and they probably thought I was either, you know, under some influence of drinking or drugs, because we had the patients that we have changed their practice significantly during our surge. So patients that were COVID positive, we were previously admitting, but during a surge, since our resources were very limited, we were discharging some of the relatively stable patients that required maybe 2 liters of oxygen to go home. But it requires a lot of time to get the home oxygen set up. So we didn't have a spot in our system that was built to kind of put the patients, you know, park them until oxygen arrived, and we needed negative pressure rooms, obviously, in the emergency department to take care of the patients. So I requested Allscripts to build an oxygen garden virtually, which we kind of walled off one of our areas in the hallway to kind of house these patients with a nurse, so they would be kind of watched over, they would get their home medications, but they would at least be out of the acute care of the emergency department. So that was effective because we have now a system that's already in place, and we've implemented protocols that are in place that the ED physicians use, the intensivists use, and they're all on the same platform. So if there is a resurgence, we've already kind of went through the mental exercise. I've already bothered the Allscripts team of creating these weird things like the oxygen garden in our ED board, so that if there is, you know, another surge that comes on, we just kind of pull the trigger and everything is kind of already in place.
Yeah, thank you so much for sharing that specific example, Dr. Singh. I think the communication piece is just it continues to emerge here as a consistent theme. And I want to move to the next question then. And Dr. Singh, we can stay with you for if you could tackle it first. You know, how can organizations achieve success during a crisis?
I guess the biggest thing I learned during this past year has been kind of keeping the frontline staff engaged and reassured. when we first started this back in April or kind of February, March timeframe, there were really no guidelines. There was really nothing to say this is the gold standard or this is how we treat patients or this is how we diagnose patients. So trying to reassure them, be at the bedside, being available to the clinicians that are at bedside to kind of see what their current workflows are in managing these patients, and then what are their workarounds, and to how do we make their jobs easier, because they're so, they're working so hard during this time, and they're just fatigued mentally, physically, emotionally, and it's just a nonstop process. Everybody thought in the beginning this would be a sprint and we'd be done, but we're a year later and we're still in the middle of it. So I think having kind of short-term goals and what success really means and outlining that and having clear, transparent communication. And because a lot of us didn't really have the answers. So I think as long as you communicate that, we'll try to get the answers. We kind of collaborate with our county public health department to kind of give us some resources, kind of get some answers. So as long as you keep the frontline staff engaged and having those small victories, I think that really is a big victory for the organization.
For sure, definitely, Dr. Singh. Bonnie, you want to tackle this one as well?
Sure. So I think another thing that's important to leading to success when you're encountering situations like this pandemic is the willingness to think outside of the box and think about things differently. And just looping back and expanding on the comments I made earlier about telehealth, one of the ways of thinking differently was to get outside of those four walls that we were used to. We had a customer in New York City that, obviously got hit hard and hit fast and hit early during the pandemic. And they dealt with a lot of behavioral health patients. And they very quickly had to figure out a telehealth solution that they really hadn't even made any instrides on before the pandemic hit, and they very quickly worked with us at Allscripts, and we were able to get their telehealth solution in and up and allowed them to continue to have their counseling and their visits with their behavioral health patients, even though they couldn't do it in the traditional four-wall way that they were used to doing. And I think that it's important that we continue to try to think outside the box and not get trapped in the way that we've always done things, or doing it, needing to do it the same way, because the pandemic sort of forces us to think about things differently.
Thank you, Bonnie. Appreciate you sharing that specific example as well. Heather, I'd love to get your perspective too before we move on to the next question.
Yeah, I think one of the most important things that we did at least for our employees, was just being really transparent and communicating often. This wasn't just important internally, though. Obviously, we leaned a lot on our partnerships with our clients to make sure that we had a good understanding of their restraints and kind of worked with them to adjust their timelines and deliverables. In some cases, we ended up rescoping entire projects to focus on things like, Bonnie mentioned telehealth, or pressing pause on key initiatives, or expanding timelines as appropriate, so that our clients could really focus on patient care.
Important points there, Heather. I want to look forward now for this last question before we dive into audience questions, which, as a reminder, you can type those in that Q&A box on your screen there. So looking forward, we're still early on in 2021. Where do you see us going in terms of the new normal in healthcare? How will the rest of this year unfold? Heather, we can stay with you to start.
Sure. So I think I mentioned previously, there's been a really big shift towards standardization. I do expect that to continue. As an EHR vendor, we've been working tirelessly to kind of create new standard packages that will meet the demands of our customers and our future customers. So I think this, kind of coupled with our Allscripts and Microsoft partnership, and the focus on migrating to the cloud, means that we're really going to be changing our implementation methodologies pretty significantly to require fewer client resources, but also to allow for an expedited time to production. both of which have really become an expectation, I think, in the marketplace. So I think that we'll see a continued shift towards not only the cloud, but a higher demand for mobile patient engagement tools like Follow My Health and Telehealth that we've kind of talked about a lot here today, but virtual visits, patient portals, and AI-powered tools even.
Definitely. Certainly for the telehealth component, I think all that rings true. Bonnie, you wanna take this one next?
Sure. Just sort of expanding on that, this pandemic has definitely gotten patients more focused on their health, and they are expecting access to their medical information, and are now. I have relatives that before I would have never been able to get them to actually look at their health stuff on their phone. And now they're calling and getting set up because and then they get mad when they can't see something that they thought they should, because they are now more focused on that than they've ever been. And I think that this has created a need for them to feel more involved in what's going on. And they are now expecting technology to provide them stuff that before they weren't even willing to take the time to look up. So it's sort of funny how that sort of caused a switch and a change in consumer expectation. And that's, something that we have continuously looked at and modified our community package to include that functionality and to be able to let our customers meet that need. And I think that is an important shift that has come out of this pandemic.
Absolutely. Thank you, Bonnie. And Dr. Singh, you want to take a crack at this one before we move on to audience questions?
Sure. I think Bonnie hit it right on the nail on that. I think it's going to be patient engagement. I think the more we kind of look over the transition over the next few years, I think there's obviously going to be a transition towards value-based care, and then more transparency within kind of our industry. I think patients will kind of definitely want to be empowered by understanding what their options are and the type of care they're getting, so they can best make the decisions for themselves. And I think that kind of push will come both from the patients as well as physicians and nursing staff, because everybody wants to kind of empower the patient, so that we can kind of align our care at the end of the day to deliver it to the patient that's kind of coming in. So, my mom, when she just got a knee surgery done about a year ago, we were kind of looking at different physicians to go to. And so there's really no method of looking, what kind of value she's getting for her care. Should she get the surgery now? Should she wait? Who should she trust? How long should she stay in the hospital? So those kind of questions that, you'll just kind of trust the initial physician that you see. I think more patients will kind of want to understand what their other options are going forward. So I think big shifts coming in healthcare, definitely.
For sure. Thank you so much, all three of you, for having this conversation with me today and sharing those insights with our attendees. We will now move on to audience question and answer session. So as a reminder, you can submit any questions you have for any of our panelists there in the Q&A box. Let's see what we got here, and we'll dive in. The first question I'll throw out there is, I think this sort of speaks to Dr. Singh, what you've spoken about with regards to alignment. What is the best way to gain physician alignment during a crisis?
Bribe them. Buy them alcohol, bribe them, whatever you can. I think it's definitely very difficult. One, because just me speaking as a physician, we don't like change. We have been trained in a way that's, this is how we do things and this is how we'll do it. But I think kind of showing them the other perspective of this will, with this kind of change and alignment that we do as an organization, this will actually be beneficial to their practice long term. So if the change requires them to kind of go through extra steps and extra hurdles for the short term, it actually might be more beneficial to them over the long term. So kind of getting their input into seeing what's in it for them in a way.
Thank you, Dr. Singh. Certainly appreciate the candid response there. Let's move on to another question. So the attendee asks, what are the benefits for an EHR to be cloud hosted?
I could take a stab at that one. There's a lot of benefits to being cloud hosted, but some of the benefits include moving to a subscription model, faster time for implementation, lower annual upgrade costs, and then also just helping organizations really leverage the software without increasing the burdens on their internal IT resources as well, I think is really important. I think the other things that the cloud brings to us, and specifically this partnership that we've kind of developed with Microsoft, is enhanced security, some flexibility, scalability, and just more opportunity. So opportunity to take advantage of future technologies that maybe we haven't even thought of yet that will be implemented in the cloud, and kind of just opens up that possibility for our product and some of our mobile patient engagement solutions as well. I don't know if, Bonnie, you had anything to add to that?
No, but I do think it's really important to reiterate the fact that being on a cloud platform in that technology really sets you up to be in a position to be able to take advantage of new functionality and new products coming down the pike. That's often historically has been a problem because it took a huge hardware change or platform change in order to be able to take advantage of the next best thing. And being on the cloud positions you in a way to be ready to accept that as it comes down the pike without having to change everything else around it to be able to use it is important.
Thank you, Bonnie and Heather. Appreciate you both tackling that one. So, Dr. Singh, this next question is directed for you. So what was the biggest lesson learned from implementing Sunrise Community Care during a crisis, and what would you have done differently?
That's a loaded question, man. So I think lots of lessons learned. I think, obviously, as everybody's poll here suggested, the limited resources. I think that's, if I had a magic wand, I would try to get more resources or rob a bank to get that. But I think it's kind of having a clear vision, kind of in the short term, to say, okay, these are going to be our short-term goals, and this is how we're going to get there. So kind of taking that approach and kind of having the bigger vision in addition to that. I think engaging the entire staff at each kind of department level, so that you manage expectations for the frontline workers in that department and also the management in that department to say, okay, this is what's realistic. This is the hope that we're trying to get at, and this is what we're going to get. And then if their expectations are way high and they feel like they're here, then there's that middle ground where we work with Allscripts and our team to say, okay, this is where we need to kind of meet in the middle. And I think if I were to do things differently, I wouldn't do it during COVID. But I think the biggest thing to do differently would be to kind of spend a lot of time and energy on prior to go live on kind of implementing, having the super users or the advocates for the program and the transition early on, so you kind of know who your go-to people will be within the organization, because you will definitely need kind of the full floor generals, so to speak, during the implementation when it does kind of get painful and people are learning any new EHR. So you need that support at the bedside.
Yeah, absolutely. I think if we could do 2020 over again, I'd say we drop COVID. Let's just not do that part. Okay, so let's take another audience question here. This may be our last one, and then we might go to some closing comments. So the attendee asked, was there any pushback to not being able to focus on customization of the system to local needs or practices? Heather, do you want to start us off on that one, and then perhaps Bonnie or Dr. Singh can add in as well?
Yeah, sure. The answer is of course. Of course there was some pushback on, some of the standard content and things like that, and even some of the standardized workflows. And from my perspective, I think that's healthy, right? That sparked a conversation between us being the EHR vendor and the client being our partner, and it kind of forces us to become better, right? I mean, we've had a lot of conversations with Dr. Singh both before and after activation, where, we still meet with him regularly and the San Gregorio team on a regular basis to continue to make enhancements to our content, our workflows, our products, to help us to continue to evolve and be better for the next client and be better for the future. So yes, there are always those kinds of things that come up. We do tend to make the accommodations, of course, for things that are regulatory or state-specific requirements. And of course, if anything is a potential patient safety issue, we address those with high priority. But the rest of the ideas that we get from all of our customers, really, those go into kind of a queue, and we review those internally, and we try to make the best decision for kind of that 80-20 rule. Like, will most of our clients benefit from this? So from my perspective, yes, there's always a little bit of pushback, and I believe that that's a healthy conversation starter. So I don't know if Bonnie or Dr. Singh, you guys have a different opinion on that.
Well, the one thing I would like to say is that inside our solutions, and especially inside our community care solution, I look at it as a journey. It's not a destination. We didn't get somebody live and that was the end of it. We're constantly looking at it, reevaluating, figuring out how we can make it better. What can we do to make it easier for our customers? Because ultimately, our goal is that EHR should be a tool that helps the clinicians be able to get the information they need and get it quickly and provide the care. It shouldn't be a hindrance. And we are continuously moving towards that goal and making changes and making modifications. So it wasn't like a static, okay, we're done. I don't believe that we will ever be done. Like, the healthcare is constantly changing, and the EHR needs to constantly change from a content, functionality, and a utilization perspective in order to continue moving forward with healthcare. And that's what we're doing. And the pushback and the questions we get just provide us a mechanism to look at
we did have another question. Sorry, I think my audio cut out there for a little while. Go ahead, Dr. Singh.
Yeah, I think what Bonnie and Heather kind of alluded to, spot on. I think for, speaking as a physician, I think medicine's kind of an art that's backed by science. Every patient population in a hospital will have their own challenges and their own kind of, unique challenges and pathology and different workflows. So I think to say that there's this kind of one-size-fits-all kind of a project that you can implement, probably not. And I think that's where our conversation started with Allscripts after the implementation was, okay, well, this is kind of what's important to our patients. And so how do we get it for Betty that checks in for chest pain that is now admitted? How do we best serve her? Because that's the type of patients that, and this is the type of protocol that the physicians kind of want and what they're comfortable with. So I think having those conversations, which are healthy, which actually is beneficial for the patient at the end of the day, because now you're initiating a dialogue, what the best practices are out there and what kind of the needs are of the community and for your patients. So I think that's kind of molding all those together kind of leads to a project or a program that best augments the quality of care you deliver.
Absolutely. So some great points there. I think we'll take one last question here and then we'll close things off. So what are the standards for considering an EHR implementation a success? I'll just open that to the group. Who wants to jump in and grab it?
Yeah, so that's a bit of a subjective question, but I would say that every organization really has their own, their own reasons for wanting to implement an EMR and for making such a change. So I think that would be really up to each individual organization to sort of answer that question and what they consider to be a success. I would say from a vendor perspective, some of the compelling reasons that we hear from our clients oftentimes are, the desire for a single patient record, the ease of sharing information across the entire patient journey. Those are, some of the biggest things. And then, of course, financial viability, patient safety, security of data and information. So again, from my perspective, I think that's a very subjective kind of question, and really that answer could be a little bit open-ended depending on the goals of that specific organization.
Appreciate that, Heather. Bonnie, you want to weigh in there just a little bit, and then Dr. Singh as well, and then we'll close out.
I agree with Heather. I believe that success is subjective, and there are always different goals established by different organizations. We could go into one organization, and they could historically have been having issues with problems in their ED. So their focus is going to be on how were we able to help in that situation. Another place could be having problems with financials. And so it's always interesting to see how different organizations do look at that differently and make those determinations. However, I also think it's important to acknowledge that change is hard, and Dr. Singh alluded to that earlier, but change is hard for humans. It always is. And I have been putting in healthcare systems for a very long time. And I always tell people that as soon as you change an EHR, the old one you had did everything perfectly, even though, you got complaints about that old system up until the day you got rid of it. So I think change is hard, and I think that factors into the success. So I think that measuring success takes time. And I think that over the course of time, your success improves and gets better. So I think that's always something to consider in your evaluation.
That's a great point about learning how to sort of measure success over time. Dr. Singh, you want to close this out here?
Sure. I think if you're still alive a year out after the implementation as an executive, you should be good. But I think the biggest success is really, it's kind of like, if you want to get healthier and you want to have a workout plan. So some people have different goals. Some people want to put on more muscle mass. Some people want to lose weight. Some people just want to be more active. So it really depends on kind of what your goals that you set out to be. At the end of the day, it's really about the Betty that came in and says, I have chest pain. And how does that program help deliver care to her? And how does it help your team deliver care to her? Has it made their job easier, and has it made an impact, a positive impact in your organization to really understand how you're doing as an organization, how the care is being delivered, and are the patients happier? If the implementation allows you initially to have success with metrics, sure, that's a good thing, but translating it to good patient experience, translating good patient health outcomes, community outcomes, I think that's where kind of the secret sauce is. So I think that would be the key success, aside from being alive still after implementation.
Absolutely. It's important, right? Being alive still. All right. Thank you, Dr. Singh. And thank you, Heather and Bonnie. It's been a great conversation. I really appreciate you sharing your expertise with our attendees today. I'd also like to thank our sponsor for this event, Allscripts. To learn more about today's topic, you can access a number of resources in your console here, as well as a reminder, just want to share with you to fill out our survey. Thank you so much, everyone.
Thank you.